Good evening, ladies and gentlemen. My name is David Thoreau, and I'm the president of the Independent Institute. I'm delighted to welcome you to our very timely event tonight, especially in the aftermath of the first presidential debate yesterday evening. The Independent Policy Forum, as many of you may know, is a forum of lectures and debates and presentations that we hold on a regular basis here at our conference center in Oakland. This is also being live streamed, so if some of you get tired of watching, you can always plug your computer in. Our program today is entitled Replacing Obamacare and Curing the Healthcare Crisis, and we're delighted to have our dear friend and colleague John Goodman. He's author, as you may know, of the very important new book called Priceless, Curing the Healthcare Crisis, which is by far the most comprehensive and thorough and insightful book on healthcare. John is the founder, president, CEO of the National Center for Policy Analysis, and I'll say a little bit more about him in a moment. For those of you who are new to the Institute, hopefully you all got a registration packet. You'll find information about the Independent Institute in there, including some of our publications, more information about John and the book Priceless. The Institute is a public policy research institute. We're an academic research institute. Everything that we do goes through peer review as far as our publications. We produce a lot of books such as Priceless. We have a quarterly journal that we publish called Independent Review. This is the current issue. The Independent Review is by the renowned economist and historian Robert Higgs, and we're hoping that John one of these days will contribute to it. We haven't had the pleasure of that yet, but we hope he will. More specifically, most Americans, according to the polls, want to repeal and replace the Patient Protection and Affordable Care Act, known as Obamacare. However, exactly what reforms contribute to the problem of high costs and poor quality access and so forth of health care is not clear for most people. And we believe that John's book, Priceless, addresses this in detail, not just the Affordable Care Act, but the whole range of government's involvement in health care and the problems of health care per se. Our view is that to create a vibrant market that would treat the sick as well as those who may get sick sometime in the future, we have to be very concerned about incentives. We have to be concerned about how to be able to access innovation. We have to be concerned about overcoming barriers that are created by government entities and special interests that use government to restrict competition. And this, of course, relates to insurance, it relates to Medicare and Medicaid, it relates to hospitals, it relates to private practice, general practitioners and specialists, and so on and so forth. The Wall Street Journal and the National Journal, among other media, have called John the father of health savings accounts, which is certainly the case. His health policy blog is the premier healthcare blog on the internet, where the premier healthcare solutions to healthcare problems are routinely examined and debated by top health policy experts throughout the country and around the world. I believe this is your 9th book, right? And John regularly appears on many national radio and television talk shows, Fox, CNN, PBS, and so on. His articles have appeared in the Wall Street Journal, Investor's Business Daily, National Review, Kaiser Health News, and many other publications. Just this past Sunday, we had an article by John on health savings accounts in the San Francisco Chronicle, and we'll plan on sending everyone a copy of that article if you haven't seen it. So I'm very pleased and delighted to have my old friend John Goodman speak.
Thank you, David, for that very, very kind introduction. I thought our office was being a little bit generous when we suggested some of those remarks, but I enjoyed every word of it. If you Google the John Goodman Health Policy blog, you're going to discover two things. First, it's about the only health policy blog that approaches health policy from an economic point of view. The people at my blog believe that the reason we're having all the problems we're having in healthcare are because we have distorted economic incentives. And when we respond to those incentives, we do things that make costs higher, quality lower, access more difficult than otherwise would have been. And if we're going to solve these problems, we've got to get the economic incentives right, and if we don't do that, we're not going to solve the problems. The other thing you're going to see at this blog is that it's the only health policy blog of any persuasion whatsoever that has a sense of humor. I don't know what it is about the field I'm in. It's just dominated by a bunch of sourpusses. And you know, a lot of them not only have no sense of humor, they don't even understand when I'm joking. And these includes people like Paul Krugman at the New York Times, which some of you are familiar with. There's no sense of humor at all. And I've gotten in trouble with him a couple of times because I wasn't being serious and he thought I was. So we created this yellow yield sign. It's for the humor challenge. It's a satire alert. And we'll put it up occasionally so that people like Krugman knows, you know, hey, don't take this too seriously. We feel like if we don't make you smile at least once a day, we're not doing our job at the blog. And we'll do things like we had a post the other day on how Obamacare is going to push all of you into HMOs and they're going to ration your health care. And underneath that, from YouTube, we had Aretha Franklin singing Say a Little Prayer for You. Then we had a post on end-of-life care, and underneath that was Bob Dylan singing Knocking on Heaven's Door. And then we had this incredible exchange between the doctors and the insurance guys, and they just went back and forth for about 50 or 60 comments. And finally, this one doctor got so exasperated, he said, you know, you insurance guys are killing our patients. I thought that was interesting. So I reposted some of that, and underneath that comment, we had Leslie Gore singing You'd Cry Too If It Happened to You. Now, we're accused sometimes of being irreverent and sometimes insensitive, and I guess the most insensitive thing we ever did happened about 2 years ago. There was a man who walked into the Parkland Hospital emergency room in Dallas, and he waited 19 hours and died before he ever saw a doctor. And we thought this was a real tragedy, and we also thought that it could happen in other cities as well. So we posted a little something on it, but underneath it we had Lionel Richie singing All Night Long, and that probably wasn't sensitive. Yeah, you should groan on that one. I like to have my cell phone with me even when I'm talking because you never know when there's going to be an emergency. That wasn't serious. But this is serious. There are more cell phones in the United States than there are people. You know, even the panhandler down on the street corner probably has a cell phone, but he probably doesn't have very good access to health care. If something goes wrong with my cell phone, there are dozens of shops in Dallas, Texas that I can walk into without any appointment, and I can get high quality, low cost, quick repairs done on my iPhone. And in fact, there are even shops that will send someone to my condo and they'll repair my iPhone in my home. And there's a national chain, and it's called iHospital, and the employees are called iDoctors. But if something happens to me, did you know the average wait to see a new doctor in the United States is 3 weeks across the country? In Boston, where we're told that we have universal coverage, the average wait is 2 months to see a new doctor. Did you know that 1 out of every 5 individuals who walks into a hospital emergency room leaves without ever seeing a doctor simply because they get tired of waiting? So my question to you is, why is the market so kind to my iPhone, so mean to me? And I think the answer is that this iPhone is bought and sold and repaired in a real market with real prices where entrepreneurs know they can make millions of dollars if they solve our problems. Whereas over in healthcare, we have so completely suppressed the market for year after year, decade after decade, that no one ever sees a real price for anything. No patient, no doctor, no employee, no employer. We bought into this notion. It's the same notion that other developed countries have bought into. It's the idea that in order to make healthcare accessible, it's got to be free at the point of delivery. And so we completely suppress the role of prices in healthcare, believing that people should never have to choose between money and healthcare. Just as they do in Canada, just as they do in Britain, we primarily pay for care in this country not with money but with time. And what we've overlooked is that when you completely suppress the price in the healthcare system, you make all the non-price barriers to care ever more important. Now, what do I mean by a non-price barrier to care? I mean, how long does it take you on the telephone to get an appointment with a doctor? And then how many days do you have to wait before you can see that doctor? And then how long does it take you to get from your home or your office to the doctor's office? And then once you get there, how long do you have to wait in the waiting room in order to see him? By the way, I think it's kind of interesting that for all the other professionals, for the lawyers and the architects and engineers, I mean, that room is called a reception area, right? But for the doctor, we call it a waiting room. True. As it turns out, those non-price barriers to care are more important than the fee the doctor charges. And by that I mean they're a bigger obstacle to getting care than the fee the doctor charges. And this isn't just true for the middle class, it's also true for people who are poor. And there are a number of studies that we can talk about if you'd like. Now, in the United States today, there are almost 50 million people who have food stamps. And they can walk into any supermarket you and I can walk into. They can buy almost any product that you and I buy. They pay the same price that you and I pay. They get to the checkout counter, they put the food stamps down, they put money on top of it, and they consummate their transaction. And you never hear it said in this country that low-income people do not have access to supermarkets, right? I mean, the worst that can happen is they have to get on a bus and go a few blocks in order to get to the supermarket. But you never hear of supermarkets saying, we're not going to take any new food stamp customers, right? That just doesn't happen. But there are in this country about 60 million people on the Medicaid program, and basically they're the same people. And what's the biggest problem people have in Medicaid? It's finding a doctor who will see you, right? I was in Boston not long ago, and as I sometimes do when I'm in another city, I struck up a conversation with a female cab driver, and I asked her how Obamacare was working for her. And she said, well, my problem is I can't find a doctor who will see me. And I said, well, why is that? She said, well, I went down a list of 20 names before I could find one who would see me. She was on Massachusetts Medicaid, which is called Mass Health. And I said, well, 20 names. I said, were you going down the yellow pages? And she said, no, I was going down the list that Mass Health gave me. All right, that's what people on Medicaid are experiencing. And it may not be quite as bad as it is in Boston, but the same problem is nationwide. And so basically what people on Medicaid end up doing is going to community health centers or going to the emergency room of safety net hospitals where they're probably not going to wait 19 hours, but it would not be unusual. The average wait in Dallas at Parkland Hospital is 4, 5, 6 hours depending upon the day of the week. If you walk into Parkland with a migraine headache, you could be there for 8 hours before anyone sees you. That is what it's like over in the healthcare sphere, as contrasted with what we're doing with food stamps. Now, at the same time all that's going on, we have a proliferation across the country of these walk-in clinics, and I assume you have them here in San Francisco, the Minute Clinic and CVS Pharmacy and then Walmart and shopping malls. And the reason for the name Minute Clinic is they're just signaling to you they know your time is valuable as well as your money. And these clinics, by the way, provide not only low-cost, accessible care, it's also high-quality care. And by that I mean the nurses, following computerized protocol with their customers for what they're able to do, they adhere to best practices and to the accepted protocols better than traditional primary care physicians. So it's consistent care, high-quality care. In Dallas, Texas, if you have an earache or you have a sore throat, the Minute Clinic is going to charge you about $75. But Medicaid only pays half that much. And the problem is that unlike the food stamp market, over in healthcare we make it illegal for the Medicaid patient to add money to the rate that Medicaid pays. It's not only illegal, it's a matter of criminal law. So if the nurse takes cash on top of Medicaid, she probably would end up in prison. And therefore, we don't find any Medicaid patients in Dallas going into Minute Clinics or anywhere else. They're down at the emergency room waiting 4, 5, and 6 hours. We could greatly expand access to care for low-income people just overnight if we would just allow them to buy health care the same way they buy food stamps. It's such a simple idea. And by the way, the same is true of Medicare. for the seniors and the disabled. So if we want to solve the problems of health care, one of the first things we have to do is liberate patients from the kinds of silly, ridiculous restrictions like that. And the second thing we need to do is to liberate the doctor. Have you ever noticed that it's really hard to get a doctor to talk to you on the telephone? Now, you know, if I call my doctor friend up and I'm inviting him out to dinner and I'm paying, then yeah, I'll probably get a return call. But it's real difficult to get a doctor to talk to you about a medical condition on the phone. The telephone, not the iPhone, but the telephone in general, has been used by other professionals for almost 100 years, right? The lawyers, accountants, architects, engineers. It's a very handy way to communicate with clients. Why doesn't the doctor want to talk to you on the phone?
I can't charge for it.
Very good. Medicare has a list of about 7,500 tasks that it pays doctors to do. And it just so happens that the telephone isn't on that list, or at least it's not on there in a convenient way. And the way Medicare pays is the same way that Blue Cross pays, and the employers and the insurance companies. So none of them are paying doctors to consult with you by telephone. If you're a doctor and the third-party payers are constantly trying to push down your fees, you can't afford to spend a lot of time on non-billable hours. You can't afford to do very many tasks for which there's no payment at all. And so that's the main reason why you don't get to talk to your doctor. Now, we get to the end of the 20th century, and all the other professionals discover email. Everybody's emailing everybody these days. Even the corner liquor store emails me. If they have a bottle of wine they know I want. I even get emails from the Minute Clinic. Back in August, they sent me an email saying, school's about to start. You know, your kids need a vaccination. And I got an email from them the other day saying, it's flu season. Have you got your flu shot yet? But I don't get any email at all from my regular doctor. And why is that? You know, you were so good a minute ago. This is an easy pop quiz. You just keep repeating that answer. You're going to get an A+ on this exam. Yeah, email is also not on that list of 7,500 things that Medicare pays for. There's no worse way to pay a professional. To create a long list of things that you're going to pay for, and then by implication, if anything not on the list, you're not going to pay for, and so if it's not on the list, they're not going to do it. Doctors are the only professional in our society who is not free to reprice and repackage what they're offering to the market. Okay, every other professional can change what they offer, can change the price. If demand changes, technology changes, or anything changes, they can respond to the market. Doctors cannot. Doctors are slaves to a third-party payment system over which they have virtually no control at all. Let me give you one more example because I think it's fascinating. Some of you may already know of Jeffrey Brenner in Camden, New Jersey. Hotspots? No? Surely you've heard of him. You've heard of him. Okay. All right. Camden is supposed to be one of the poorest spots in the whole country. If you live in Camden, you're either on Medicare, you're on Medicaid, or you're uninsured. There's virtually no private insurance there. Brenner is this entrepreneurial doctor. He's a researcher. He's curious about why things work the way they work. And so Brenner's going through the hospital records, and he discovers that 1% of all the people who live in Camden are responsible for 30% of all the spending by the hospital. So he goes down the list of the 1%, and he discovers this one patient who's just a total mess. This guy weighs more than 600 pounds. He's a diabetic. He's an alcoholic. He's a drug addict. Half the year, he's in the hospital, and the other half of the year, he's abusing himself. So Brenner takes this guy under his wing, and he gets him off alcohol, gets him off drugs, gets him in AA, finds out he's a Christian, gets him going to church, gets him to sign up for some welfare programs so he has some financial stability in his life. And lo and behold, the guy isn't going to the hospital anymore. And since he's not going to the hospital, his expense to the system goes down, 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 saving tens of thousands of dollars. So this was so successful, Brenner set up this little clinic. He started doing it for other people. Brenner told me that he can drive down the streets of Camden and he can point to whole buildings and tell you how much an entire building is costing Medicare and Medicaid because people with bad lifestyles tend to cluster together, birds of a feather and all of that. In any event, Brenner today is saving you taxpayers millions of dollars by getting patients really to change their lifestyle, change the way they're living. And my question to you is this: how much do you think Medicare gives Brenner in return for all the millions of dollars he's saving us as taxpayers? 0. Very good. And how about Medicaid? How much do you think Medicaid gives him for all that? Yeah, right there. Why? Because social work, and that's what mainly Brenner is doing. I mean, there's some medicine, but mainly what I'm describing to you is just social work. It just happens to save millions of dollars. And that just, it really isn't on the list of 7,500 things that Medicare pays for. Because whenever you pay a professional by task, you're never going to think of everything you need to be thinking of. Again, a crazy way to pay anyone. So what I said at my blog was, we need to let Jeffrey Brenner become a millionaire. He called me up and thanked me for that, by the way. But what I argued was, if he saves the system $1, let's let him keep 20 cents, okay, or 25 cents or something. And when I told the guys in Washington about this, they said, well, why would we want to do that? And I said, I mean, he's already doing what we want him to do for nothing. Why would we want to pay him? And I said, because if you just pay him, if you let him get rich, then you send the signal out to all the rest of the doctors in the whole country. And the message would be, if you could figure out a way to save taxpayers money and raise the quality of care, we'll do something back for you. We'll pay you in a different way. You tell us how you want to be paid, and we'll pay you that way. So the second thing we need to do is to liberate the doctors. And then the third thing is the entrepreneurs. I'm often asked if free markets can work in healthcare. In fact, there are lots of people who think they can't. But what I've discovered is that the only healthcare markets that are really working and working well are the markets where we have a free market and where basically the third-party payers aren't. So you show me a healthcare market where there's no Blue Cross, no employer, no Medicare, and I'll show you a market that's probably working really, really well. Cosmetic surgery is one of those markets. Just looking around the room here, I would guess that most of you don't know much about this market. Give it another 10 years. Even you will have an interest. All right, here's a market where people are paying with their own money, and what do? You get a package price. You don't have to wonder what it's going to cost. They tell you in advance. By package, I mean it covers the doctor, the nurse, and this is the facility. You have price competition. Over the last 15 years, we've had a huge increase in the number of procedures, like 700 or 800% increase. At the same time, we've had all kinds of technological change of the type that we're told increases costs everywhere else in the system. And yet the real price of cosmetic surgery has just keeps coming down over that 15-year period. LASIK surgery, same thing. You have package prices, you have price competition, quality competition, and by the way, those two things tend to come together. In LASIK surgery, huge increase in number of procedures, all kinds of technological change, and yet over the last 10 years, the real price of LASIK surgery has gone down by 25%. I've already mentioned the walk-in clinics. There's Teladoc of Dallas, which actually does provide you with a telephone consultation, developed outside the insurance system. We do this for our employees. We pay $1 a month per employee. If I'm in another city and I need a prescription, I call up, it costs me $30. And the doctor, I don't know what doctor is going to answer the phone, but he can call up my medical records, he can see what I've been doing, and he can prescribe what I need. And they have 2 million customers right now. Shows you what markets do and what entrepreneurs can do when the third-party bureaucracies just are not in the way. This is totally different from the approach of the Obama administration, which has no faith at all in entrepreneurs or in markets, but thinks that from Washington they can figure out what is the best way to practice medicine and then tell all the doctors what to do. You've probably heard Barack Obama say what he wants to do in health care. It's the same thing he says he wants to do in education. He says, we're going to go find out what works, and then we're going to do it, by which he means we're going to experiment and have pilot programs and demonstration projects, and then the things that work, we're going to copy them all over the country. The only difference between healthcare and education is that in education, we've been doing this for 25 years with no success, whereas in healthcare it's only been, 5 or 6 years with no success. The Congressional Budget Office has looked at all this on three separate occasions, and they've said none of the pilot programs are working, none of the demonstration projects are working. You're not going to lower costs, raise quality by thinking you can do an experiment artificially designed in Washington and then copy it. There are in our healthcare system many, many examples of high quality care. There are centers of excellence, but I know not of a single one that was created by the buyers of care. Every single one has been created on the supply side by an entrepreneur or a small group of entrepreneurs who figures out how to do it better and is succeeding. Never is this happening because some bureaucratic insurance entity tells them that medicine should be practiced in a different way. Let's talk about Obamacare for just a moment. People are very concerned, and rightfully so. I believe there are 6 big problems with Obamacare, and they're so big that even if all the Republicans leave town and leave the Capitol building to the Democrats, they're going to want to do something about these 6 problems. And if they don't, they're going to be hearing from all their constituents. And the first problem is that Obamacare is going to require all of you to buy an insurance plan whose cost is going to grow at twice the rate of growth of your income. Now, Barack Obama didn't create this problem. We've been living with this problem for 40 years. Real spending per person on health care has been growing at twice the rate of growth of our income. And it's not a uniquely American problem. We're not the worst. In fact, we're sort of in the middle of the pack among developed countries. But all these countries are going up an impossible path. And you don't need to be an accountant or an economist, or you don't need a pocket calculator to know if you're buying something and its cost is increasing at twice the rate of growth of your income, it's going to be crowding out everything else you can buy. And as a matter of fact, if today's young people, if we continue on this path, by the time they reach the retirement age, there's going to be nothing left but health care. They'll have nothing to eat, nothing to wear, no place to live, but they'll have lots and lots of health care. All right, you don't take that too seriously because we're not going to get that far out before we figure out some better way to do it. Again, Obamacare didn't create the problem, but it locks us onto the path. It makes it hard for you to do the kind of adjustments you would normally do. Normally, if your insurance premiums were really going up for any other kind of insurance, you would go for a smaller package of benefits, a higher deductible, you'd do something like that, but you're going to be limited in your ability to defend yourself in that way. Number 2, it's a bizarre system of subsidies. The hotel that I'm staying in down the street is an example of what's about to happen. I don't know if you've ever noticed, but when you walk into a hotel, most of the people that you see are making about $15 an hour. These are the maids, the waiters, the waitresses, the busboys, the custodial people. These people are not making a lot of money, but let's say they're making $30,000 a year. Obamacare is going to require that hotel to provide insurance to these employees, and for the family coverage, it's about $15,000. So it's going to require the hotel to provide a benefit that's equal to about half of what they're now making. So I can see the meeting now. Employees, there's bad news and good news. The bad news is we're going to cut your wages in half. The good news is you'll have this lavish health care plan. There is no new subsidy in this legislation for that hotel or those employees. Okay, they're just going to be caught. But now, if for some reason the hotel isn't providing the insurance, and so they have to go over into this new health insurance exchange, then there are lavish subsidies. And people at this income level only have to pay about 2% of their income, and the government pays for all the rest. So that's like a $13,000, $14,000 benefit provided by the federal government versus a $50,000 penalty over here at the place of work. At the same time, if you take the few people in the hotel that make considerably more money, say a manager who's making $100,000 a year, that manager gets no subsidy in the health insurance exchange. But if the hotel provides the insurance to the manager, the hotel can pay those premiums with untaxed dollars, which means they're escaping let's say a 25% income tax, a 15% FICA payroll tax. I don't know what your income tax is, state income tax here in California is. It's high, I see. Okay. All right. So with that income tax, now the ability to avoid all that is like the government's paying for half the cost of the insurance. So everybody with above average income is going to want insurance to continue from their employer. And if you're below average income, both you and the employer will be better off if you find your way over into the exchange. How do you get over there? I don't know because I don't know enough about employee benefits law or labor law, and I'm just not creative enough. But you know, the hotel may make them all independent contractors. It may make them all part-time. It may divide in two. So we have two corporations. One employs the higher income folks and provides insurance. The other employs the lower income folks and doesn't, pays a $2,000 fine. And the problem with that is that I can envision the whole industrial structure of the United States changing just in response to health insurance subsidies, which is not how you want important decisions to be made. It's not how you stay competitive in the international economy. The third problem is the insurance exchange itself, where people are going to be participating in a system where insurers have terrible, perverse incentives. And they have to charge everybody the same premium regardless of health care costs, expected health care costs. And you don't have to be in the business to think very long about it to realize that these companies are going to make profits on healthy people and losses on sick people. And so what are they going to do? They're going to try to attract the healthy and avoid the sick. And this isn't a new phenomenon. This is going on right now anyway. It's just going to get worse. I like to contrast health insurance with casualty insurance. You all see on the TV casualty insurance ads all the time. You've seen the black actor standing in front of the town that's just been destroyed, and he says, it took 2 minutes to destroy this town, and then he says, are you in good hands? Okay, that's the Allstate ad. So what's that ad saying to you? He's saying, we know you don't want to think about insurance until something bad happens, but if the bad thing happens, we're going to be there for you. That's the way they're advertising. Aflac, everything that Duck is doing, it's something's going wrong, right? Something bad is about to happen. It's all about bad stuff. My favorite print ad is the Chubb ad, where the guy's in a canoe and he's about to go over Niagara Falls backwards, and it says, insurance doesn't matter till it matters. In Washington, D.C., where the federal employees participate in an Obamacare-like exchange and have been for a long time, in the fall is open season when all the employees get to choose a new health plan. They also see ads, in this case for health insurance, and these ads never, ever, ever talk about anything bad that might happen to you, which means they never talk about why you might really want insurance. They never mention cancer or AIDS or heart disease or any other expensive to treat condition. Why? Because they are not interested in attracting you to their plan if you have one of those problems. What they like to do is picture young, healthy families, and the implicit message is, if you look like the folks in this photo, you're the kind of person we want. If you don't look like those folks, we're not sure that we have a good fit here. The bad incentives do not end at the point of enrollment. So after people enroll, the incentives are to over-provide to the healthy, because you want to keep the ones you have and attract more of them, and underprovide the sick because you don't want the ones that you have, and you certainly don't want to attract any more of them. A lot of you probably have not stopped to think about this fact, that our health care system is not only bureaucratic, but it's potentially very unfriendly. And if you've got a lot of problems, it can be very difficult to deal with. In the world you're now living with, though, you have certain protectors and defenders. You have an employer. You have an insurance broker. But just think to yourself, what happens when the broker goes away? What happens when the employer gets out of the way? Then you're going to be on your own. Yeah, well, you know how much you can rely on those guys. Now, the fourth problem is over on the other side of the insurance market. It's on the buyer side. And we had the Supreme Court ruling on the mandate, and a lot of going back and forth about whether it's constitutional or not constitutional. But the reality is that this is a really weak mandate to begin with. If you don't buy the insurance, the IRS is not going to be able to go garnish your wages. It's not going to be able to attach an asset. The only thing it can do is just withhold your refund. So weak mandate, weakly enforced, plus the IRS said the other day they're not going to hire a lot of people to go around and audit tax returns to see if people are insured. There's a virtual announcement that they're going to ignore the mandate as a practical matter. And what that means is that we as buyers of health insurance will have perverse incentives. And our incentives will be to stay uninsured until we get sick, and then buy the insurance and get the bills paid, get our medical care, and then drop the insurance again. So in Massachusetts, these are called jumpers and dumpers. You jump in when you need the insurance, you get everything done, and then you dump the plan when you don't need it anymore. But if we all do that, if the only people with insurance are people who are sick and generating high medical bills, then insurance is going to be horribly expensive, and private insurance will not be able to survive. The fifth problem is that we've way overpromised. Obamacare promises what it cannot deliver. And according to the projections, in another year and a half, we're going to insure about 30 million new people. And if the economic studies are correct, they'll try to double their consumption of health care. And then all the rest of you will be forced to have more generous insurance than you otherwise wanted. There's a whole long list of preventive services that you're supposed to get with no deductible, no copayment. A study from Duke concluded that if we gave everybody in the country all those preventive services, that the average primary care physician in the United States will be spending 7.5 hours of every working day just doing that, not taking care of any real problem, just giving screenings to healthy people. So what I'm describing to you is a huge potential increase in demand. There's no increase in supply, no new doctors, no new nurses, no new clinics to speak of, and that means a big rationing problem. And it means that those non-price barriers, those waiting times, are going to grow, and it's going to take longer and longer to get anything in the system. And if you're in a plan that pays below market, you're going to be in trouble. And what I mean by a plan that pays below market is Medicare for the elderly and the disabled, Medicaid for the poor, and if the Massachusetts example is followed, people in the newly subsidized health care plans. These are the most vulnerable people, and they're going to have increasing difficulty finding a doctor who will see them. I bet you when the Democrats voted for this, they thought they were helping those people. They're going to be surprised to learn that the most vulnerable populations are going to have less access to care because of this bill, because of giving all these benefits to the middle class. The vulnerable populations are going to have less than they had before. The final problem is the problem of seniors. It's really true that Obamacare takes, over the next 10 years, $716 billion out of Medicare to pay for new insurance for young people. And where's that money coming from? Mainly, they're going to squeeze the payments to doctors and hospitals. So that according to the Medicare actuary, in a short amount of time, Medicare fees will fall below Medicaid for doctors, which means if you're a senior, you're suddenly going to look less desirable than welfare mothers for the doctors. What all of you are going to think about, if you haven't thought about it before now, how many of you have a concierge doctor? Anybody? How many of you know what one is? Okay, all right, so you have thought about it. Somebody's told you about it. Well, you're going to need one. Concierge doctor is a doctor, around the country, for about $1,500, $2,000, the concierge doctor sees you the same day, next day, provides you, he becomes your agent, spends more time with you. But when a concierge doctor becomes a concierge doctor, he was seeing 2,500 patients. Now he's only seeing 500. Okay, he's giving them more time, more attention, but he left 2,000 behind. Well, what happens to those people? Well, their problem just got worse. So the more doctors that convert, the worse it gets for everybody else. And we're going to get two-tiered medicine very, very quickly. Now let me just go to what I think are some solutions to all this, and then we'll open it up, hear what you have to say. I went to Capitol Hill about a month ago and suggested to the doctors in the House and the Senate that they need a health contract with America. And it ought to have a few simple ideas that people can understand, and because nobody understands Obamacare, right? I mean, you can't explain anything about Obamacare in simple words. So the first idea was, we don't need a mandate, but let's have tax fairness. Let's give everybody in the United States the same tax deal if they purchase private health insurance. And I think we could replace everything we're doing now, the tax subsidies and the spending subsidies, with, for adults, about $2,500 refundable tax credit. For a family of 4, it would be at $8,000. Again, refundable tax credit. You get it even if you're not paying taxes. And that's for private health insurance. And to put this in perspective, the typical employer, large employers are now spending about $16,000 on family coverage. This credit is only $8,000. So it pays for the core insurance that we want people to have. They want everything else. They want in vitro fertilization, acupuncture, fine. But they're going to pay for that with after-tax dollars, unsubsidized dollars, they and their employer. And it will occur to them that that last $8,000, every dollar they spent is a dollar they could have spent on something else. And it'll occur to a lot of people in the insurance business. If they can figure out a way to provide a plan that only costs $8,000, they're going to have a lot of takers. So everything would radically change if we could do this. That's the tax fairness component. Then the universal coverage component is something that no one ever talks about, but if, except at the NCBA and at the Independent Institute, if people turn you down, and there will be people who will turn down the $8,000 offer, then what do we do with that money? We send it to local safety net institutions in the area where the uninsured live. So money follows people. If everybody in San Francisco gets private insurance, we don't need to send money to safety net hospitals. Just all the money pays premiums for private health insurance. But if everybody in San Francisco decides not to be insured, then that same money goes over to safety net institutions. So you fix the federal subsidy, it's the same for everybody, and you send it depending on the choices that people make. And then the third thing we need to do is we need to promote portable insurance, which is what the middle class says they most want. It's the thing that's most missing in our system. Every poll shows this. They don't get it under the current system. They don't get it from Obamacare. But by portable insurance, I mean insurance that travels with you from job to job in and out of the labor market. And did you know in California right now it's illegal for an employer to buy Blue Cross individual insurance? That employer has to buy Blue Cross group, even though Blue Cross is selling individual insurance that people can own and take with them. It's against the law for the employer to buy the individual insurance. Well, we just need to turn that around. That's exactly the opposite of what we should be doing. And California is not unique. Texas is the same way, and so are the other states. Just one second. Then two more things. We need a generous health savings account. Already it's been a marvelous success. There are 27 million people with these accounts. Obama is about to allow the flexible spending accounts to roll over, so it's no longer use it or lose it. That will be another 35 million people. So we're getting lots of people with an account where they're controlling money, and this forces the supply, the providers of care, to change what they're doing. But we need it to be even more flexible. We need it for the chronically ill. The studies show that the asthmatics, the diabetics, and other chronic patients can manage their own care with a little bit of training. And if they can manage their care, they ought to manage the dollars that pay for that care. And then finally, we need real insurance. And by real insurance, I mean that you ought to be able to insure against the possibility of getting a pre-existing condition. And that's what happens when I buy life insurance. If I buy life insurance and I get a prostate cancer test and it turns out bad for me, I don't get kicked out of the pool. My premium isn't selectively raised. I get treated just like everybody else. That's what we need to do in healthcare. And if people, for some reason, have to move from one insurance plan to another, and health condition has changed, so now the new premium is going to be higher, the original insurance ought to pay that extra premium. Now, that's what I call real health insurance. Some people call it change of health status insurance. But in any event, it allows each of us to get from the insurance world what we really want and need to protect ourselves in this new environment. So those were my 5 ideas for a health contract with America. The doctors put it up at the Health Caucus website, but I must tell you that on the Republican side, even though they talk about repeal and replace, they're totally committed to repeal. There's almost no enthusiasm for replace. So if the Republicans win this election, Obamacare will get repealed, but there is no appetite for any kind of major reform, which disappoints me. David introduced me as a father of health savings accounts, so let me just conclude on this note. The most important thing about the health savings account idea, in my opinion, is empowerment. Again, we're dealing with a system that's very bureaucratic and can be very unfriendly. And my view has always been that if you control the money and you have the power to make your own decisions, this system is going to work a lot better for you than if you cede that money and that power to some impersonal bureaucracy. You've been a very good audience. Thank you very much.